Okay, so much for my smooth presentation here. Is that it? Thank you, Mr. Sista, right? Can always count on Dan. Well, so the story of health reform in New York, to me, really has been a story of how do we reduce Medicaid dollars to hospitals. Some of that legitimate, some of that maybe not so legitimate. It's understandable why. Medicaid is a huge part of the New York State budget, and as a result of that, it's a wonderful target. I was talking to Kenneth Adams, who I was complaining about the number of dollars that we needed at Lutheran to support Medicaid, and he said to me, "We give you that many dollars?" So it's not exactly the message I had in mind, but if you look at the percentage that hospitals really are of Medicaid, we're really only 19% of the story. And so when we talk about this bloated Medicaid system and looking at the comparison between one state and the other, it's a very fundamentally unfair comparison to hospitals, especially because we have borne the brunt of the reductions in Medicaid. And these reductions are enormous. But as terrible as the reductions have been for all the hospitals, reductions in the hospitals in Medicaid have been absolutely devastating for the safety net hospitals. And that's really what I want to focus on today. Because I firmly believe that we all need safety net hospitals. That the health system is in its way, as crazy as it is, an ecosystem, and there needs to be a balance. And safety net hospitals have their role to play if we are all going to play our roles. And they must be preserved if healthcare in New York is going to be preserved. What is a safety net hospital? Well, truthfully, 10 years ago, I wouldn't have known what a safety net hospital was. I was on the other side of the street. But now I do know, and we take care of an enormous number of Medicaid patients, a disproportionate share of Medicaid patients. Our patients are very often illegal immigrants. That's just a fact of the situation. And very, very few commercially insured patients. So even the efforts to get commercial rates up do very little to help true safety net hospitals. What about Lutheran, where I am? Well, 72% of our patients are medically indigent. We counted the other in order to present for today, we counted the first 100 patients walking into our door one Monday morning, 57 countries, 100 patients. So I don't have to tell you the cost of translation services and support and really what it means to provide culturally competent care. Those cost special dollars. And it's essential that the reform, whatever that reform be, understand and support the need for these special services. Lutheran doesn't need public dollars. Lutheran survives on public dollars. This isn't a matter of how much we can reduce. It's a matter of if we survive or not. And Lutheran is just one of several safety net hospitals in this state that are very important to survive. When you have a concentration of poor people, it costs more than taking care of individual poor people. And so when we look at what it takes to take care of Medicaid patients when they're scattered throughout the system, it's very different than when you bring them all together in one place. Physician salaries are a perfect example of this. When I was at another teaching hospital, we didn't have to compensate our physicians in order to cover the emergency room. They were delighted to do it because they picked up a lot of insured patients. Sure, there were one or two patients along the way that they had to eat the cost of. There would be no neurosurgeons in this community. There would be no obstetricians in this community. And if you look at the safety net hospitals, there is an enormous coincidence between safety net hospitals and trauma hospitals. And if with those hospitals providing level 1 trauma are costing an enormous amount to do it, and it's the only way that these services are being provided in these communities. Historically, New York has recognized this. In the 1980s, there started to be special pools and patches and all kinds of things were called, very disparagingly. But the bottom line was it was a recognition that standard Medicaid compensation does not take care of safety net hospitals. And there needs to be special accommodation made if we are going to maintain these hospitals. And if we don't maintain these hospitals, we don't maintain the hospital system in New York. Disproportionate share now is under enormous attack, not just only in New York State, but in the federal government. And when I went down to Washington and talked about safety net hospitals, I was told that undocumented immigrants are not a politically tenable issue. Well, it may not be a politically tenable issue, but it's a reality in my emergency room every day. So what happens to these reforms now that are going on under the last 5 years of healthcare reform in New York State? Well, what's happened is that the safety net is being ripped apart. Because although there are dollars certainly that are going from the inpatient to the outpatient, which sounds great, nothing's going to OB services to compensate for what's happening. And if you look at the number of people that need OB services and the cost of providing OB services at safety net hospitals, there's been nothing that's been done to compensate for that. The unit of service measure doesn't work. It just simply doesn't work. When you look at the dollars involved and who gets the dollars, it doesn't work. And why is that? Because previously the pools were weighted. So those hospitals that had large numbers of poor people got a higher percent of the pools. And now that we're trying to make a level playing field, there is no level playing field. And what's falling off the edge is the safety nets. So what's happening? What's going to happen? Well, I've been told there are two things that can happen. We'll close the safety nets. We'll let the publics take over. Well, if you close the safety nets in Brooklyn, there are 16,000 births that have to be accounted for. I don't think that Kings County and Coney Island can accommodate 16,000 more births. I don't think all of you want to accommodate all the services of poor people that are going on. I'm also told that the big networks will come in and take over. Well, in fact, it's something we're not very attractive to the big networks. Let's face it, North Shore's the smart money, and they didn't take over Mary Immaculate, they took over Lenox Hill. So what's going to be left out there is hospitals that we need a Medicaid program that recognizes that safety net hospitals have a role in this ecosystem of healthcare and need to be preserved. That's what we need to do both at the federal and at the state level. Not because of everything we do is right, but because we're needed and we need to get it right. And so we need to make special accommodations for safety net hospitals. When St. Vincent's closed, Beth Israel Medical Center bought the for-profit wing of the cancer services at St. Vincent's. Lutheran Medical Center took over the homeless program. Thank you.
Thank you, Wendy. Our